Well, they are the Thompson twins on WJER, actually a trio. But when we hear Doctor on the radio on WJER and online, WJER.com, we are happy to tell you that we're joined again by Dr. Thomas Rogers, Colonel Dr. Thomas Rogers from the Cleveland Clinic Union Hospital. Another edition of Medical Minutes here for a brand new year. Welcome back, Dr. Rogers.
Thank you, Kelly. We're excited. Another great year, and it's just ready to be able to talk about what we're doing and just give great information to our patients. So we're excited.
It has been a busy year. We're going to recap 2024 and maybe a sneak peek ahead to this upcoming year. Dr. Rogers, let's begin with many of our listeners have been aware about the Union Hospital Radiation and Oncology Clinic. How can you update us there?
Yes, thanks, Kelly. So as most know, our radiation oncology clinic closed for renovation and replacement of our linear accelerator and our CT simulator back at the end of August, after a real nice relationship we had with the Altman team that was here. So now that we are with Cleveland Clinic and really working with their cancer team, the new clinic will open sometime in June, we're hoping, but it's on time, on track. And at that point, it'll be great for patients who have to have radiation oncology treatments, which sometimes can number in over 30, and where they're coming in, many days in a row. It will save them those extra trips that we've been having to do all the way up to Canton. So we're excited to be able to have that for our patients. It's extremely important for us to be able to offer that service again. So we're excited that it should be open on time in June. We expect to have a ground or a opening ceremony at some point, a ribbon cutting, and maybe even some philanthropy opportunities here coming up too for the community. So.
Oh, it's good to keep in mind. A great way to give back to this local Dover, Ohio campus. By the way, I saw congratulations are in order under the umbrella of Cleveland Clinic, getting I think number 2 out of the top 3.
Yes.
Across the nation.
Yes,
So,
number 2 I think in the world. So it's not even in the country. So pretty amazing. It's a great organization and just such great people that work in the entire organization, and just the specialty care that can be provided up in Cleveland, and then all of us providing that primary care and support for our communities. It's just an amazing relationship.
Absolutely. And with the Radiation Oncology Clinic, again, you mentioned the linear, help me with that again?
The linear accelerator and the CT simulator. So those help to, when you have a cancer, it helps to locate where it is, and they can then concentrate the beam only in the areas that they need. And so part of that is identifying it and then locating the beam. And we're going to have upgraded equipment. The equipment we had before was about 15 years old, so it was ready to go. And this new equipment will be state of the art, and it's going to be great.
Oh, that is so exciting. And hang on, because if you have a high schooler, they are going to want to pay attention to what's happening too. We'll get to that in a moment. First though, how about the Joint Commission accreditation received at the end of this past year?
Oh, it was great. So the Joint Commission is our accrediting body, and they it was the first time we've had them since 2008. We had DNV. It was a company that does something similar across the United States. But Joint Commission is who the rest of Cleveland Clinic has, and it really shows that you are a quality and safety perspective. You really provide the best quality and safety that you can for your patients. They look at our environment of care, all the things associated with it, and we did just a great job. Really had no conditional findings, had 0 conditional findings, and had most of the findings related to our building. It is an older building, so a lot of environment of care things that usually you can address and take care of. But the team did a wonderful job, especially since we just started Epic in October of 23. So within a year, then we had Joint Commission come in with all those new systems that we put in place, and the team just did an awesome job. Our caregivers knocked it out of the park and really did a wonderful job. So we're accredited now for the next 3 years, and had no follow-up either that we had to have since we had no conditional findings. So pretty cool.
Wow, big congratulations there. And anyone who maybe has never had to enter the hospital before for any reason, you're not aware that you are being watched, you are being tested, and making sure that you're offering the finest of care. Because even in my own family, I've had situations in another city, hospitalization, and it was really a sad thing to hear that they were having a hard time as a recovering patient even getting water or having a clean hospital floor. But things like that, you cannot get away with that. Cleveland Clinic, Union Hospital, Dover, Ohio, flying colors. So that's wonderful.
Thank you. That is exactly right. In fact, our environment care and our team, our EVS team, does a wonderful job. It is one of the cleanest hospitals I've been in. and they just do a wonderful job. And it is so important to make sure we're treating patients correctly as well. That's really what it comes down to.
Well, in care, we see the billboards around town. Families caring for families. Dr. Thomas Rogers on the air with us live on this March 4th. Some exciting news continuing along with our medical minutes on the recruitment of new physicians.
Well, we had a great year in 24. So just to recap, we hired 3 new family physicians, Dr. Zangari, Dr. Raquel, and Dr. Page. They are wonderful new docs right out of residency, and a huge need for us to fill primary care positions. Then we had Dr. Alvarez for OBGYN, Dr. Walton, and Dr. Spolarish both added for orthopedics. So wonderful to add those new docs in the end of the year I think we all started after August. So we continue to always recruit though, Kelly. It's really important for us as a smaller hospital, always be looking. Cardiology is always a huge need for us. Dr. Gross, who's been around for many years, and many people here in town know him. But once he's planning retirement, we've got to try to be able to place him. Hard to replace him, but that's going to be a big need for us. So we continue to look for cardiology, but we're always looking for primary care, any physician, general surgeons, all those. We always need to be ready, because I always say we're kind of one doc away from the disaster, because when you lose one of our docs here in town, it's such a big hit on us. So recruiting is so important. So we're just excited to add the docs we have there, and they're wonderful docs. So if folks need primary care, I think they still have room on their panel. So if people want to call and make appointments with either of those 3 docs, please do so.
That's a real challenge sometimes when, again, you don't realize you need a doctor, and where do you begin? So that's wonderful to know the recruitment energy is continuing. Again, Cleveland Clinic Union Hospital, allowed out of your office, Dr. Thomas Rogers, joining us here across the street. We're happy to be your neighbors, by the way. How about talking about the recruitment, and let's reach down to the younger years now. Opportunities are even available for high school students.
We're excited. We've been, really since COVID, it's been a difficult time to be able to get kids back into the hospitals to understand what goes on in the hospital. We talk about it being a city within a city. And so the UH Tech program we used to have, we're going to rename it. And our goal is that by this spring, start to invite kids back into the hospital. We'd like to be able to take them into our operating rooms, to the emergency department, or just look at our facilities, look downstairs, all the boilers, which are amazing how well they still work, and with the age of it, but they're just amazing. They work amazingly well. And then just, to look at the hospital as a whole, but really to put on, if we can get them into the operating room and see what it's like. We just want to be able to expose kids as much as we can to see what it's like to work in a hospital, and look at it's not just about being a doc or a nurse. We want them to be able to experience everything we do in a hospital, and that we have jobs right out of high school, college, if they go to professional degrees, all the things we can do. So we're excited to be able to try to get kids to understand what we do, and it may make a difference for them. I know I did that in high school. We went, and you say, wow, I would like to do this, and so we want to give that opportunity. It's been hard though. There are shadowing programs, so we're going to try and make sure that we try to make it as easy as we possibly can for kids to get in to see us.
Okay, and again, Dr. Rogers, yourself, Canton Central Catholic grad, on to Wright State, then on to the Pentagon, back here in Dover, Ohio. We are so lucky to have you here on Medical Minutes today. We've got a couple more minutes, and I do want to mention back to the high school students. With our high schoolers and younger, and maybe a little older, AI on their smartphones, it's been a way of life. But as you mentioned, something really sent a chill up my spine. It's the human caring element. You can't watch that on a YouTube program. You've got to be there to experience it. And Dr. Rogers, on the other hand, a student might get in there and realize, ooh, this is not for me. Have you ever had anyone faint on you?
Oh, we have. I mean, I used to always, the Marines would always faint during deliveries when I was delivering babies. So there's always some you expect. Kids are usually pretty resilient. They usually do a pretty good job of when they come into a hospital. But you're right, the AI is going to be a huge piece of that. And actually, I went to a conference, they talked about kids getting AI certificates to even help them in anything that they do, whether it's medicine or not medicine. So I think some of those things where kids can utilize what they know already to their advantage in the future.
Mm-hmm. Amazing. Again, Dr. Rogers, we have another point to bring up. Unfortunately, the influenza, is still the top reporting story, it seems, the last couple of weeks here, and it doesn't look like it's going away nationwide. What can you tell us about here in the Tuscarawas Valley?
Yeah, so at the week ending the 22nd of February, we had 400 hospitalizations just in the east central area of Ohio, including Tuscarawas County. I think it includes Summit and Stark. But Ohio is still listed as very high flu activity. And across the country, the last report I had was 19,000 deaths across the country.
Oh my.
We were swamped last week. So we had, at one day, we had 18 flu cases. So usually it's influenza A in the hospital, actually hospitalized. So we were very busy and really is consistent with what the rest of the state is showing. So it continues to be a busy time, but people can still get flu shots. It's still available, usually even up to probably May or June. Usually at that point we turn it over and wait till the new year starts and have it available in August or September. But it would still be great if you have not gotten your flu shots. We do recommend it. Just take care of yourselves, keep yourselves healthy, wash your hands, and protect yourself if you're sick. Try to stay away from others when you're sick. But it's a very busy flu season.
Well, and again, I'm thinking the St. Patty's Day party, get together, Easter right around the corner. You have to think about the others that you'll be around that may be more vulnerable to becoming ill with a really serious, well, in some cases, as you said, a deadly influenza. So again, Dr. Rogers, thank you so much for that look back. What are you most looking forward to for 2025?
Well, we just, I think as a hospital, one thing we really want to work on is a lot of stuff like transitions of care and how do we take care of a patient from the minute they report to our ED from when they get discharged from the hospital. So that's one thing we're really going to be working on this is that transitions of care across the board and looking at how can we make sure they get their post-hospitalization appointments and those kind of things. But we're excited for what we're going to do here at WJER. We got a lot of great topics similar to what we had last year, but in a couple weeks we're going to talk with pharmacy. Kathy Wiggs will be here to talk about drug take back, but just about medicines in general. Everybody always has questions about pharmacy and what should I do about my medicines and how do I take them and how should I do things when the doctor prescribes things. So it'll be important to us to talk about that. Kathy will cover that, and then we're going to look at colon cancer screening, breast cancer screening. We'll talk about summertime things like we did last year. We'll get some ER docs in here, and the biggest thing is we like to showcase our docs and our providers, and also look for opportunities to share with the local community if there's some people that we can bring in like we did last year with the health department. So
wonderful. Looking forward to those programs. Medical Minutes here on WJER. As I look across the street, I really should be asking you, Dr. Rogers, can you give me some dirt? Literally.
You see that building over there? Yes. It's going to be great. I think we're excited about the housing that's being built there. So
yeah, well, we were talking about giving tickets away to the Hall of Fame Village in Canton. Here on the boulevard, you could be the halls of healing. You like that?
Sounds great.
We've got the halls of healing right here. Dr. Rogers, thank you so much for the update. Again, we have so much more to cover, and we will bring you back very soon for another edition of Medical Minutes. Stay healthy yourself, and thank you for the great advice and information. Always a pleasure. Dr. Thomas Rogers from the Cleveland Clinic Union Hospital, another edition of Medical Minutes here on WJER.